Diabetes doesn't just affect the blood sugar, but it disrupts the body's entire metabolic system, including how fats, which are lipids, are processed. When blood sugar and lipid levels are both poorly controlled, it creates a dangerous environment in body that can accelerate the development of atherosclerosis, which is a condition where arteries become clogged and harden due to fat deposit. Atherosclerosis is a leading cause of heart attack, strokes, and other serious cardiovascular complications, especially in people with diabetes. That's why understanding the link between diabetes, lipid metabolism, and vascular health is essential, not just for treatment but for prevention. Dr. Arindam Naskar has been very instrumentally in breaking down the connection between diabetes, lipid metabolism, and atherosclerosis. So, in today's session, he will explore how these three systems are interrelated, why lipid control is just as important as sugar control in diabetic patient, and what steps can be taken to reduce long-term risk. Dr. Arindam Naskar is a distinguished consultant endocrinologist at Apollo Clinic, Kolkata. He holds an MD, is a member and fellow of Royal College of Physicians and brings extensive experience in managing endocrine and metabolic disorders, with a special focus on diabetes and its cardiovascular complications. He is known for his patient focused approach, clinical precision, and commitment to evidence based care. With years of experience in treating complex conditions that bridge metabolism, lipid disorder, and vascular health, Dr. Naskar is here to help us understand how diabetes, lipid metabolism, and atherosclerosis are intricately connected and what can we do to manage and prevent long-term health risks. With this, Dr. Naskar, would you like to add something before we starting the conversation?
So thank you for your nice introduction, Princey. So this is a very pertinent topic, diabetes, lipid metabolism, and atherosclerosis. As day by day, we are seeing that there is a huge explosion of diabetic cases as well as heart attacks and strokes, not across our country, it's throughout the globe. So it's a major concern, major public concern. We have to address that. So this topic is very much pertinent and very much effective. I think that people will realize that diabetes and the alteration of lipid profiles and also development of atherosclerosis, they are interlinked, and we should be aware of these deadly combinations. So yeah, please.
Yes, definitely, doctor. So, with this, we'll start with the conversation. Dr. Naskar, can you please explain how diabetes affect the lipid metabolism and why this combination increases cardiovascular risk?
Yeah, so that's a very important question. So if I say, yeah, diabetes is associated with lipid abnormalities, however, I would say that even per se diabetes is associated with increased risk of atherosclerotic cardiovascular disease because high blood sugar level, it damages the blood vessels. As well as diabetic, we all know that there is more inflammation. There are pro-inflammatory markers are activated, and that ultimately damages the blood vessels, and there is endothelial dysfunction also. So, per se diabetes itself is associated with increased risk of atherosclerosis, clogging of arteries, hardening of arteries. And there is a condition which is known as diabetic dyslipidemia. There is alteration of lipid metabolism and lipoprotein metabolism in diabetic patients. That, as in diabetes, there is hyperinsulinemia. As there is insulin resistance, there is more insulin production, and that's why there is more production of triglyceride-rich VLDL by hepatic cells. So there is increased triglyceride production as well as decreased good cholesterol like high density lipoprotein cholesterol. And also in diabetic patients, as there is more oxidation, formation of reactive oxygen species, the LDL cholesterol, the bad cholesterol, even they become worse. Actually, by oxidative methods, they convert to the small density LDL cholesterol, which is more atherogenic. So all these conditions like increased triglyceride level, increased formation of small density LDL, and also the decreased HDL, is all these factors, they are atherogenic milieu. They set the fire to more clogging and more hardening of arteries and development of atherosclerosis. And ultimately, there is more heart attacks, stroke, and also the peripheral arterial disease. And diabetic patients, they are almost 2 to 4 times increased risk of having atherosclerotic cardiovascular disease in comparison to non-diabetic population. So these two are very important and that should be feared of. So that's
Yes. Thank you so much, doctor, for explaining this important topic. So, doctor, leading to this, my next question is, what are the key lipid markers that diabetic patients should regularly monitor to prevent complications like atherosclerosis?
well, that's not marker. Yeah, definitely. The thing is that whenever you are getting the diabetes diagnosis, whenever the patient first visit our clinic, so the base level lipid profile should be assessed. First time, type 2 diabetic patients or type 1 diabetic after 5 years of diabetes. So first, the baseline test should be a lipid profile. Apart from the other tests, I'm not mentioning other tests because the topic is today the lipid profile. So baseline test, and then once in a year. However, if the baseline result shows that there is some dyslipidemia or impaired lipid function, then we need to monitor more frequently, like 3 or 6 month interval. And the triglyceride level, the HDL cholesterol level, LDL cholesterol level, these are the commonest tests we actually do for our standard lipid profile test. However, if a diabetic patient he has any family history of premature atherosclerotic cardiovascular disease, suppose his father or mother or any of the first degree relative they have suffered from heart attack or diet. In case of male is less than 55 years, in case of female less than 60 years, then we should add lipoprotein A. And now the every guidelines, even the Lipid Association of India, our country guidelines, they're saying that diabetic patients once in a lifetime they should undergo the lipoprotein A testing. So apart from the standard test, that test may also be added, and that should be done once in a year.
Okay. So, doctor, is it possible to reverse or maybe just slow down the progression of atherosclerosis in people living with diabetes?
Yes, of course, there are lots of modifiable factors because the non-modifiable factors like genetically we are exposed more chance of like diabetic 1 decade earlier than the Western counterpart, as well as heart attacks, cardiovascular disease 1 decade earlier. So the we cannot change our gene or the race. So, however, the modifiable risk factors like you need to do a healthy, follow a healthy lifestyle, like you need to do a exercise properly, exercise and healthy lifestyle, and we should diet has very important role, and also the lipid lowering therapy. So this combination therapies they ultimately help to slow down the development of atherosclerosis.
Yes, doctor. As you just mentioned about the diet and the physical activities, so how do these lifestyle interventions like this diabetes and physical activities, also the weight management, influence both the blood sugar and the lipid level? These both factors,
Yeah, so
in
very
brief.
important and very important and practical question. So the first is diet. So diet is very important that we should avoid so much saturated fat in our diet. The saturated fats like the red meats, like the whole butter, the ghees, and the fried foods, we should avoid that, and we should increase the intake of fiber in our food, and also there should be moderation of alcohol consumption and the smoking cessation. That's very important, and so that should be followed. So diet has very important role to play here. Next is exercise, very important. So please, who are leading the sedentary lifestyle, mostly the corporate sectors, most they are there, so that their not job is physically demanding. So those who are so we have to avoid the sedentary lifestyle. Exercise is very important. At least 30 minutes per day aerobic exercise, like walking, jogging, cycling, whatever. 30 minutes per day for 5 days in a week. So recommendation is 150 minutes aerobic exercise in a week, and if possible, you can go for a twice weekly resistance exercise. That would be very much helpful. And regarding exercise, suppose a patient, the elderly age group of patient, he or she would like to start the exercise and have already atherosclerotic cardiovascular disease, I would recommend them to start low and go slow. You should not jump in a venture that vigorous exercise. So there are also certain conditions. A diabetic
Yes.
patient, suppose they have a significant peripheral arterial disease as well as some retinal problem, they should not start with vigorous exercise. They should start low and go slow. Regarding weight management has very important role to play, because if you lose your body weight, then is in the insulin sensitivity improves. Our body perfectly utilizes insulin to the cells. And also the regarding the lipid profile, improvement of cholesterol, triglyceride, as well as LDL cholesterol while you exercise, because the fatty acids will be utilized by the cells. So the studies and the researchers have shown that even up to 5% body weight reduction is very much significant impact in blood glucose control, as well as reducing your dyslipidemia. So that's very important. So diet, physical exercise, and reducing body weight is the key. I would say the cornerstone of managing these things.
Yes. So, doctor, as of now, we have discussed about the lifestyle modifications. Like, so if we come to the point, if we see so from the point of view of medications or medicines, so what role do medications play in protecting the heart and arteries in diabetic patient?
So medications have very important role to play. The thing is that suppose a patient who has tried a diet and lifestyle modification, but despite that they are not been able to bring down the LDL cholesterol levels, we should start medication. There are lots of medications available, lipid lowering medications, like most common is used like statin group of drug, the bempedoic acid, PCSK9, ezetimibe, lots of drugs available. And now the ADA, American Diabetic Association, they are recommending that each and every diabetic patient whose age is more than 40 years, irrespective of the lipid profile level, they should be on moderate intensity lipid lowering therapy. That's very important. And if the age is less than 39, then you need to do a cardiovascular risk score calculation. If the cardiovascular risk score is high, if it's at least more than 10%, then you can start the moderate uh, intensity statin therapy or lipid lowering therapy. And if age more than 40, it's more than 7.5%, then they should go for the high intensity therapy. So lipid lowering drug, what they do actually, they actually the plaques are built up in the arteries. So they actually uh, dissolve those plaques in the arteries, and the arterial hardening is completely resolved. And I would not say the 100%, but yeah, definitely significant reduction of this plaque volume, atheroma formation. So it's very important role to play the lipid lowering drugs.
Yes, with this, the medical or medication adherence is also important. Like people usually think that if we get in control with any condition, that we can discontinue the medicine.
Yeah, that's very important
Right.
that this therapy should be continued lifelong usually, and you should not stop these medicines. Suppose if you have done a blood test after 6 months or 1 year, and your lipid profile comes fantastic level, so most of them I've seen that they stop the lipid lowering therapy. So don't do
Yes.
that. You always take advice from your doctors. And also in diabetic population, even if the LDL cholesterol at the target level, because there are different target levels set for the diabetes with the other comorbidities, diabetes with established atherosclerotic cardiovascular disease, the different target levels are set. But still, even if the value is at target level, please don't stop medication. So please take your doctor's permission. But yeah, there are some, maybe some few side effects maybe there, I would not say, but they are not very common. But you should discuss with your doctor, but please don't stop medication by yourself. So that's very important. You should continue this therapy for throughout your life.
Yes, thank you so much, doctor, for sharing this important information. So, lastly, doctor, do you have any message or tips for our audience on this particular condition?
Yeah, my particular tips is that how many of you do exercise at least, or walking, jogging, whatever. Not, you don't need to go to a gym like specialist exercise therapy. So please, if you are in home also watching television, you move your limbs and like hands and legs, because any movement is important. Thing is that if you can go outside, you can simply walk around your room, and also you can do squat if you are not having some severe osteoarthritis problem. That's a separate thing. So please avoid sedentary lifestyle, and regular exercise is very important, and avoid outside food, because many of them they frequently take outside food. So try to be stick at homemade food. However, it's not possible for everyone who work outside, Plus take some healthy
Yes.
foods. Don't take this like saturated fat and like the very trans fat fried food. So please, the food habit is very important. And nowadays we are seeing lots of heart attack cases at very comparatively aged like 30, 40 years. So there is no age bar. So previously we used to get the heart attacks more than at least more than 50 years of age. So because stressful life, lack of sleep, so many job stress, and they are smoking, they are not exercising. So that's a holistic approach. So the actually the main thing is that the event had happened. The process has been initiated few years back. So please exercise regularly, whatever like any movement, 20 minutes, 25 minutes, 30 minutes, and please have healthy lifestyle and healthy food. That's my message. That's very important.
Yes,
Medication
as you
will
have
play the
said,
role.
yes, doctor. You have also said that it is we can see these conditions in youngsters also. Usually, we should break this myth that these kind of conditions are not for only elder people, but it starts in younger population also. So it's
Exactly.
one of the thing is that we should accept the things and start our medications or lifestyle modifications for the same, right?
And day by day, the
Yes.
young cardiac disease patients are increasing day by day. That's a matter of concern for all of us.
Yes, definitely, doctor. So, as we conclude today's session, a heartfelt thank you, Dr. Arindam Naskar, for breaking down such a complex and the crucial topic with clarity and also with the depth. So, your insights have helped us understand how managing blood sugar and lipid levels together is a key to preventing serious complications like atherosclerosis and heart diseases. To our viewers, also thank you for joining with us. We hope this session has encourages you to take a more proactive role in your health, whether that means regular screening or lifestyle changes, or can be just simply being more informed, which is more important nowadays. So stay tuned for more expert-led discussion that empowers you to make better health decision. Until next time, take care of your heart, your sugar level, and yourself. And don't forget to follow us on social media for more health updates and tips. Dr. Naskar, once again, thank you so much for joining with us.
Thank you, Princey, and thank you all our audience for your patience sharing, and thank you all.
Yes.
So please stay
Thank you,
healthy.
doctor.
Stay healthy. That's most important. Thank you.
Yes. Thank you so much.